We are back on Taking Care of Business on Koerner Radio News Talk 1180. Our guest by phone is the president of the Pacific Research Institute, Sally Pipes.
Sally, there seems to be a lot of people that support Obamacare. Are they all in the same party? I mean, are there any Republicans that support Obamacare, or is it all Democrats?
Well, I mean, there might be a few, but certainly, when the bill was passed back in March of 2010, in fact, on March 23rd, it'll be the second anniversary of the signing of the Patient Protection and Affordable Care Act. No Republican voted for it. At the time, the Democrats had the presidency, the House, and the Senate. We still see 53 to 54% of Americans polled would like to see this legislation repealed and replaced. And in the Gallup poll that came out last week, 82% of Americans polled would like to do not support the idea of the individual mandate, which is a key part of Obamacare. So I don't know who the people are that are supporting it, but certainly the Democrats in the House and in the Senate, many of them supported it. Some of them, Barney Frank, who is retiring, of course, really wanted a public option. His goal is a single-payer bill. McDermott from Washington State, supports a single-payer. So it's going to be interesting to see how this all moves forward. And particularly, that's why it is so important that this legislation be repealed and replaced so that we can get affordable, accessible, quality care for all Americans. But that is going to come from not increasing the role of government through increased taxes, subsidies, mandates, and controls on insurance companies. This is going to come from empowering doctors and patients, changing the tax code, allowing people to buy insurance across state lines, getting the states to do medical malpractice reform like Texas did, like California did years ago with the micro law. These are the kinds of things that need to be done so that we actually can develop a competitive market in healthcare and not a single-payer government-run system such as exists, in Canada, where I'm from. And the Fraser Institute just came out at the beginning of this year with their new publication, Waiting Your Turn, a guide to hospital waiting lists in Canada. And the average wait last year from seeing a primary care doctor to getting treatment by a specialist was up to 19 weeks. That's almost 5 months. And it's the highest since the Fraser Institute started monitoring waiting times back at the beginning of the 1990s. So, this is what it will mean to us unless we repeal and replace, that we will be on the path to single payer. Government will say how much we can spend on health care. In America last year in 2010, we spent 17.9% of gross domestic product on health care. Canada spends 10.4%. That's what the government spends. That's what they say they can afford. And that is why you get long waiting lists, ration care, lack of access to the latest technology and procedures, and why so many Canadians come to the U.S. and pay out of pocket for procedures that they feel their life is threatened or they're in terrible pain. There's the cost of pain, and that they come to the U.S. and pay for treatments and procedures they can't get or feel the waiting time is too long.
Sally, we had we had Walt Williams on last week, and he brought up something that I didn't even think about. I spent a lot of time, as you do, in Vancouver, and he was talking about a lot of companies in Washington State, advertising in Vancouver to let people know that they can come across the border and get the procedures done. Have you seen that?
Oh, absolutely. If you read the National Post, the Globe and Mail, which are Canada's two national papers, you will often see ads from, most of Canada's 32 million people reside just north of the American border. So whether you live in, British Columbia, and then you have Washington State, if you live in Alberta, you can go down into Idaho. People in Ontario go into Michigan. People in Quebec go down to Florida. A lot of people in Quebec in the winter go to Florida and have procedures done. So you will see ads for MRIs, for CAT scans, for knee surgeries. Danny Williams, the Premier of Newfoundland, 2 years ago, when he was told that he needed some heart surgery and found out that in Newfoundland he couldn't get it done and he would have to be on a long waiting list in Ontario or Quebec to have it done, he just packed up his bag and went to Mount Sinai Hospital in Miami and paid out of pocket and had his non-invasive surgery done, came back to Newfoundland was, really criticized by the Canadian media, who said, how could you possibly, as a premier of one of our 10 provinces, go to Florida and have this done? And Danny Williams said, it's my heart, it's my choice, and it's my health. I mean, Canadians have an escape valve, and I often ask people, where will we as Americans go if we get the same kind of system? I mean, I know there's a private hospital being built in Costa Rica. A lot of top docs are going down there and working. I mean, but you don't want to be having a heart attack or a stroke and saying, I've got to, get on a plane and go to Costa Rica or go to India or go to Singapore. So it's very, very important. This is just such an important issue because we have to rebuild our healthcare system, because it is the finest in the world, and people come from all over the world. And of course, there's no question that these clinics that advertise in Canadian newspapers from the U.S., I mean, obviously they're getting business, or they wouldn't be advertising. So, as I say, it's a wonderful thing for Canadians. And there are in Canada a number of doctors who have, taken the bull by the horns and set up private clinics, which are illegal under the Canada Health Act. My friend Dr. Brian Day in Vancouver has a very successful orthopedic clinic with a lot of docs. He is being sued by the British Columbia government for this, and yet it's just such a wonderful thing for people in British Columbia to have this option. I think with the new Prime Minister, Stephen Harper, who's very conservative, for the first time in 23 years, the Conservatives have got a majority in Canada. And it'll be interesting to see what he does with healthcare. I think what he's probably going to do is, it's very hard to get rid of a government program once it's in place. And the Canadian government takeover of healthcare has been in place long enough that some people don't even know anything else. But I think what he's going to do probably is allow a lot of these private clinics to sort of grow from the bottom up and not shut them down. And then ultimately, through the process, we will have, a more free market medicine in Canada with extra billing, user fees and things, and it'll be terrific. And yet here in this country, where something has not worked in Canada and in Great Britain, and we're seeing all these problems, isn't it odd that this country thinks that they need to go down the path of these countries that have a system that has proved not to work?
Our guest by phone, author of The Pipes Plan, Sally Pipes.
All the things you were just talking about leads me to the seniors who are in for a rude awakening when they want to seek treatment. And as you know, if they want to seek treatment and it's denied because they don't have the value to society, they can't even go out and mortgage their house and take the money and buy the services on their own because it will be illegal and the doctor could be prosecuted. So tell us a little bit about the problems that seniors are going to be facing.
Well, you're absolutely right. I mean, under the Patient Protection and Affordable Care Act, the idea it was said that $500 billion would be taken out of Medicare over the 10-year period, and of course that is in order to add 18 million people to Medicaid, the program for low-income Americans. The president had two main goals: universal coverage and bending the cost curve down, and we know that neither of those goals will be achieved under Obamacare. By 2019, the Congressional Budget Office says there will still be 23 million Americans uninsured. The decade 2014, which is when most of the cost drivers of Obamacare come into being, to 2024, the cost of this plan will not be $940 billion over 10 years. It's going to be about $2.5 trillion over 10 years. And by adding 18 million to Medicaid, our seniors are going to be hurt. And I think they're finally sort of slowly realizing that this health care law is not in their best interest. We're seeing changes to the Medicare Advantage plans. The president wants to eliminate Medicare Advantage, which is the private plans for people on Medicare. They're very, very popular. About 11 million, about a quarter of our seniors are members, do subscribe to the Medicare Advantage plans. And, it's going to become more expensive, more difficult, and ultimately, I believe, Medicare Advantage plans will be eliminated. So seniors are going to find that, that they will not be able to go to the doctors that they have in the past, because a lot of doctors, with the reimbursement rates from government being 20% below what docs get in the private sector from private insurers, we're already seeing that 1 in 3 new Medicare eligible patients can no longer find a doctor, and I think that is just going to get worse And while I don't like to talk about death panels, this is a way of rationing care to our seniors, and it does reduce cost if care is denied.
Well, if you have no value to society versus someone in their 40s, and they have to make a choice between who's going to get the services, who do you think is going to get the services?
Well, you're absolutely right, and that's what happened to my own mother in Vancouver, British Columbia, back in 2005 when she felt she had colon cancer. And I said, well, you'll have to get a colonoscopy. And it was denied because people in their 50s in British Columbia were on a waiting list for, over 6 months to get a colonoscopy. So, ultimately, my mother did get a colonoscopy in December of 2005, but she'd lost 30 pounds and was hemorrhaging, and she passed away 2 weeks later from metastasized colon cancer. That is a way to control cost by denying care. And that is not... Americans are impatient. They don't want to be told they can't have the latest MRI, the latest positron emission tomography scan. They want it, and they're used to having it. And it's going to be very, very. There's going to be an uprising when people realize what Obamacare means for them and their health. But the problem is, with anything, with any legislation, it's very, very difficult to get it removed from the books once it's in power. Even with the CLASS Act, which is a long-term care provision, under Obamacare, Kathleen Sebelius said last fall that it was going to be too expensive. They couldn't, implement it. But on the other hand, it still hasn't been repealed from the legislation. And I think the Republicans are going to try, but it has to be, unless you repeal these things, they can come back.
Yeah. Let's pick up there when we come back. We'll be back in a moment with Sally Pipes on Taking Care of Business on Koerner Radio, News Talk 1180.